Hello there and welcome to the Reflection Show with me, Martha Inspires. Today I want to delve into cervical cancer. We all know that cervical cancer is usually in January. Awareness month is usually in January, but it doesn't matter. Cervical cancer affects women all year round. So if we are passionate about women, that is important that we make sure that every woman out there is safe and reminded to go for regular screening or regular checkup. Let's take a breather. When we are back, we delve into more. Stay tuned. Growing up, it was so difficult finding answers to all the questions that bothered my young mind. As soon as I found my purpose and understood my mandate, I made it a mission to answer as many questions as possible, bothering young people. I have mentored, inspired, and helped young people unearth their potentials through the Martha Inspires Foundation. However, I feel it is time to bring the conversation much closer to you. We have you in mind, you the young person. With my team of experts, we bring to you the Reflection Show, a show that focuses on addressing issues young people face, helping them to unearth their potentials, and giving them nothing but the best avenues in helping them solve issues that they may face in their young age. Join me, Martha Inspires, every Thursday and Saturday at 8:30 p.m. on Truth TV, the Reflection Show, restoring hopes. Welcome back from the break. I will be speaking with Dr. Anna Maria Sinomo Sharadan. I hope I got that correct. She's a consultant in obstetrics and gynecologist at the Tamale Teaching Hospital and principal investigator of the cervical cancer screening program in the northern region. She's a big woman. And also Miss Amina Atipaga, she's a midwife in charge for the cervical cancer prevention program in the northern region. So you see, they are the two best people to actually delve into this conversation. And you also get to know that in northern region, it's something that we have to take very seriously, because some of us don't take it seriously. And there are lots of myths and misconceptions around cervical cancer. But they will let us know that it's really happening, or women are actually getting cervical cancer. So we all need to be safe. Thank you so much for joining me.
Thank you for having us.
Okay, so cervical cancer has been, one of the, should I say, trending women health issues that, apart from breast cancer, that this is also one of the issues that I usually hear about or I speak to experts about. I want us to look at, cervical cancer. What is it in the first place? Let me come to doctor.
Okay, so yes, what you are saying is a reality issue that we are facing in our population, female population in this environment. So I think that it's important that our female know what is cervical cancer. And that's in that way they can also take themselves to at least to avoid this cervical cancer.
Yeah.
For her, for her family, for their sister, their mother, their aunties. So cervical cancer is a disease. It's a cancer. It's a cancer that is affecting the cervix of the wound. There is a wound, and the cervix is the part of the wound that is outside from the abdomen. That is the one we approach it through the vagina. So the cervix is from where the baby is coming out during the delivery. This is the cervix.
Where the baby
passes, the opening is the of the womb, is the mouth of the wound. So that is important that the woman knows that this part of the wound that we call cervix can be infected and also can have a cancer. And the cancer is that. So, and also the cause of the cancer, cervical cancer, is because there are some infections, like viral infections that we call human papilloma virus, that is infected the woman's cervix. And if the woman is not taking a screening earlier, this infection can becoming later in future in a cancer. And it's a common disease in our environment because it's the second cancer that is affecting our women, African women. And that is important that the woman do a screening. The screening means that the woman needs to seek for intervention, like let me see how my service is.
Okay.
And then, so the nurse, the one is trained or capable to do the screening, they're able to do the screening to verify whether this service is healthy or not.
Okay, so let me come to Miss Amina. Why is it important for us to screen? Why shouldn't we have to wait till, it's detected? But why is it important for us to screen for cervical cancer?
Yes, cervical cancer, I always say cervical cancer is a silent killer, which many people are not aware of. And so screening is for early detection of this disease. The good news is that it's preventable. So it's good, very important for every woman to screen for early detection, which can be managed, treated, and prevented.
Okay, so after, it's important for women to screen. So how long, maybe, should I, in a year, when is it advisable, or how many times is it advisable for me to screen?
Yes, screening recommendations depends on the age and risk factors. And so, but generally, screening is done among women from age 25 to 65 years.
Oh, okay.
Yes.
Wow.
25 to 65 years. Yes, so they have to undergo regular screening. But we have screening options. We have 3 of them. We have VIA, which is visual inspection, and the acetic acid. This one is to detect any precancer lesions on the cervix, any changes on the cervix, which can be managed, treated, so that the cancer doesn't progress in future. Then we have the pap smear, which is also to detect any precancer cells.
The pap smear, that's the one, like I usually say, like the one like the ear cleaner they will put inside to.
Yes, they come in various different forms. Yes, so we have some that the traditional one. That one is a slide that you can put on. So that one is the one that will detect if there are any abnormal cells on the cell. But that one is taken to the lab, and it takes about 2 to 3 weeks for you to get your results.
Hey.
But the VIA is instant. Within 1 to 3 minutes, your results is ready. Then we have one that is called the human papilloma virus test.
Okay.
This one is actually to detect any high risk human papilloma virus, which can be managed. So that one, when to screen depend on the type you are doing. So with the VIA, every 3 years, if tested negative, you have to come every 3 years to do it. And then with the pap smear, you can do it alongside with the HPV.
Okay.
So if it's only the pap smear, it's also every 3 years.
Okay.
But if it's with the HPV, 5 years, that you have to come and do it again.
Okay. Doctor, why is it
And
a
then-
hell? Okay, before.
I'm not done.
Okay.
So, and then women also living with HIV, AIDS, or any other conditions that weakens the immune system, they also need regular screening.
Okay. Okay. So, doctor, why is it a health concern?
So,
Especially in TTH, in Tamale and its environs. Do you see a lot of cases of such?
yes. As I mentioned before, it's the second cause of death.
Second cause of
Death
death.
following the breast cancer.
Wow.
So that's it's really remarkable when we do the statistics. When we review the statistics, you say, okay, so cervical cancer is getting the first rate, or the top of the one of the top of, let's mention 10 diseases. Cervical cancer is the one.
Wow.
So then you see like the breast cancer is follow. But currently it's like in between cervical cancer and breast cancer. They are the one is taking the top of the diseases in this way in the hospital, but not even the hospital. It's even at the region, even national. So we are going to national statistics. You also see that the same behavior. So that is why in Tamale Teaching Hospital, so we are doing a screening in order to screen as much as possible our patients to get the earlier diagnosis of cervical cancer. When we get the earlier diagnosis of cervical cancer, or when we get the positive of the tests, the screening tests, as well as
like if you screen early and you are detected.
Amina mentioned all the tests that Amina mentioned we are already giving to those services at Tamale Teaching Hospital. So if we are able to screen the patient and the patient we are able to detect the cervical cancer is in early stages, so if it's easier for us to offer a method of treatment. So there are different methods of treatment. So one of the more affordable and also easy to or feasible to treat is ablation. So thermal ablation. So we offer that.
Trauma, you mean?
No, it's ablation is like we treat, we bend.
Okay.
We treat the cervix lesion, like a bend that lesion that was diagnosed during the screening. So we bend that lesion, and the patient is outpatient. The patient cannot necessarily to be on admission. So we treat the patient like in outpatient, like in consultation. We have already 3 centers in Tamale Teaching Hospital, equipped with trained nurses and midwife, and also with equipment to treat the patient. So this is the best that we are doing currently in Tamale Teaching Hospital to screen our patient and also to treat the lesion when the lesion are detected during the screening.
So apart from screening, what else can be done to prevent cervical cancer?
So there are many things that we can do. It's not only the screening. So even the prevention, terms on prevention is not started from screening. Terms of prevention started earlier. So because, of course, there are some lifestyle that we need to modify as a women. So for instance, the drinking alcohol, the smoking, we need to modify that. And also we need to modify the sexual activity. You know, cervical cancer is living with this kind of infection, sexual transmitted infection is living with. So if the woman reduce the number of partners, and also the partner also reduce their numbers, so we also do prevention. I said earlier because this is one intervention that they can do by themselves, but also there is a vaccine against this infection that we mentioned, this virus.
Cervical cancer vaccine.
Vaccine, exactly.
That's my first time of hearing that there's a cervical cancer vaccine.
Yes, because there is a HPV vaccine, is human papilloma virus vaccine against this infection. That this infection is leading with cervical cancer, not immediately, but in future. That's why if we put this, if we would offer this cervical cancer vaccine in our adolescents and our even girls and boys adolescents, they're able to avoid this disease, this cervical cancer in future. Because cervical cancer is not started from this moment on time. No, it's taking time to develop because there are some changes that may producing around the cervix, the epithelium, you know. So, but if we get the able to offer this cervical cancer vaccine, let's mention like that. Let me use your own words. So we also reduce the incidence of cervical cancer in future in our women.
Okay, let me come to Ms. Hamina. What are some of the barriers that you feel like is the reason why most of us are not coming for screening?
Thank you very much. Well, you know, our background, especially in the northern parts, where we come from, our cultural backgrounds, our religious backgrounds is one of the barriers. Well, somebody will say that, why will I come and expose myself? It's immoral for me to expose myself for another person to see.
Okay.
Yeah.
Yes. So it's one of,
Even your colleague woman.
yes.
Because I believe that with the screening, it's mostly women who actually do the screening.
Yes. Yes.
Yes, it's a barrier. It's a serious
Wow.
one. And then women have no voice. They can't speak for themselves. They will have to wait for the man to say go
Before
they go. So they sit back. Some of them, you go and talk to them, but they will tell you, I cannot come because my husband has not given me the permission to come.
Wow.
And so it's a serious barrier.
Wow.
Yes. And then some of them too is just lack of awareness.
They're
There are
not
some
aware.
people who have never heard of cervical cancer. They don't even know what it is. So it's one of the most serious barriers, awareness. They are not even aware of it. Then we also have limited health facilities
Yeah.
with equipped health professionals who know how to do the screening. So who then tells them what the cervical cancer is and who screens them. So it's a barrier. And then the myths.
What are some of the myths you hear?
And misconceptions.
Misconceptions.
Yeah.
There are many.
Yes.
What are some that you hear?
Some of the myths is that, oh, cervical
painful.
is painful. The screening is so painful. And then, oh,
They cannot conceive.
yes, they cannot conceive.
If
When
you come and screen, you won't conceive.
that is their thinking.
Wow.
That's their thinking. And then some of them too, I feel fine. So why do I come to screen? I'm not feeling sick. But they are not aware that this cancer doesn't come with any signs and
Yeah.
symptoms. So they only sit down to feel sick before. They are not even aware. They don't know that you don't have to feel sick before. Yes, and then
And also the age, because they are younger.
yes, they feel it's the
that
older people that get affected with cervical cancer and not the young ones. And then this stigma
Okay.
Related to cervical cancer, they think that cervical, especially when you go to speak and you say it is related to sexual transmission, they feel they will be stigmatized.
You are promiscuous.
Yes,
And
yes. So they don't even want, and then they fear the results, fear of knowing that, oh, I have it. So others say, oh, if I don't know of it, it's better than knowing that I have it. But they are not aware that, oh, if you screen early, it can be prevented or treated.
okay. And how about sometimes to financial,
Constraints.
Yes, the
Yes,
constraints.
yes.
Is it expensive to screen? I know once a while there are free screening here and there, but apart from the awareness month, if I walk into TCH now, do I have to pay?
Yes, sometimes we have time we do free screening.
Okay.
It is only that period that you can walk in and get it done free. Apart from that, we just take a token.
Okay.
Depending on the type, we have three screening options.
Okay.
So depending on the type, let's say with the VIA, which is very affordable, very, very affordable, we take just 50 Ghana cedis, and you will come after screening. It will take 3 years before you come and pay another 50 Ghana cedis to screen. So that is very affordable. But many people are not aware. But the other ones, they are a bit higher, like the pap smear and the HPV DNA testing. They are a bit costly.
Okay.
So it's a concern
Okay.
when it comes to the cost.
Okay, doctor, what other concerns? You are part of the research or the team that is seeing all of this in Northern Region. What are some outstanding misconceptions or issues that you find or you hear about cervical cancer?
So, we are working as a team, and we have shown a lot of consent about cervical cancer. So, and we also try to at least to work on that to bring the best to our patient. So one of the misconception or maybe less understanding about cervical cancer is like, for instance, let's make it like that. So we as staff, we as doctors or nurses, midwife. So even at that level, sometimes there are some misconception about cervical cancer.
Even medical people.
Our staff, medical
Wow.
people, they are not feeling like it's part of their
job description.
Not job description, if not like even they have to be involved in this program. So for instance, we have the experience that some of our own staff, we need to treat them with cervical cancer in advanced stages. So you see, if this is one of the problems that we are facing.
So it means that they themselves are probably not screening.
They are not going for a screening, and themselves maybe for that misconception or any situation, they don't go for a screening. But we need to treat them when they are having this cervical cancer in advanced stage. So what we are having in mind is not even our patient that we have to do cervical cancer screening. No. So we need to also bring aboard our staff. So this is one that we important thing that we are doing as a team, as doctors, as one we are leading the program, because if they cannot able to do or understand that they have to do the screening, they cannot able to replicate in our society. Not only the patients, also the friends, the relative, etc. So we are having a good feedback. So we established the program, as I mentioned before, almost a year, getting to 2 years. So we work in doing the curriculum, to develop curriculum, because our main concern is train our staff, and the staff is like the one
to develop a curriculum.
We already developed a curriculum for the training, and the curriculum for the training already developed, and we started the training last year, and up to this moment we have trained approximately 27 midwife and nurses, but not only in Tamale, from Tamale Metro. So it's around the northern region, districts and health facilities. And take it that this is the main concern for us, how we can help our population to diminish or decrease the number of, at least the incidence of cervical cancer on the soil. This is what we are doing. But the most important thing is that when we trained the staff also have to replicate, have to be involved in the cervical cancer where they are back to their positions. No, it's not like we train and the patient just get the knowledge. No, you get the knowledge, and also you have to open the services to bring these services to our population. So this is the most important thing for our training. And really we are making a lot of improvement in that way.
Okay, let's look at awareness. Do you think we are doing awareness properly?
Yeah, for now, we are doing our best. And that is why we have started this training. We've not limited it to only Tamal Teaching Hospital. We have been able to train a number of midwives and nurses. We've trained about 10 districts in the northern region, and then one from the upper east region, so that when they get back there, they are able to create awareness. They're able to go into the communities to create awareness. As I sit, I go to the villages. I don't limit myself to only Tamal Teaching Hospital. I go to the villages. I go as far as up to Mile 9. There are remote villages around there.
Wow.
I go there. I'm able to go into the communities. I look for women groups. I look for especially this shea butter processing centers. This is where women the vulnerable ones are found, because they have to go and work for someone to get their daily bread.
Yeah.
They don't even care about their health. And so I go to meet such people, the leaders, I talk to them, and then they organize them. So I
Okay.
talk to them. So anytime we have the free screening, I organize means they all come down to Tamal Teaching Hospital and they are all screened.
For
So
free.
for free.
Wow.
So we are actually not limiting ourselves to only even Tamal Metro. As I speak, Tamal Central, we have trained 2 midwives to create awareness and to do the screening at the same time. We've trained midwives from Tamal West Hospital.
As well.
We have trained SDA, midwives from SDA, Tamal RCH. We have trained some midwives there. We have gone up to Yendi. We have trained midwives. We've trained midwives from Bimbla Hospital, Bandai Hospital, Tatali Hospital, and then Upper East. So for awareness creation, for now, as I speak, I'm telling you that it is ongoing.
Okay.
Yes, and any of them call on me at any time, and I have to travel there. Sometimes I go with Dr. Anna Maria for us to mentor them when they have challenges. We go to sit with them and then to see how we can go forward.
Okay, so we are still here looking at cervical cancer, and yeah, maybe our focus is a bit on northern region because we want to delve in there and let everyone understand that the Tamale Teaching Hospital is available and is open to screening or giving you that education you need on cervical cancer. And one key thing that I've learned is that once you screen, it will take you about 3 good years before you go again to screen. That is, if you are negative. If you are positive, I think that treatment starts immediately. So no matter how much it may be, I think that it is important for us to save our money to screen for cervical cancer. Let's take a breather. When we are back, we delve into more. Stay tuned. Growing up, it was so difficult finding answers to all the questions that bothered my young mind. As soon as I found my purpose and understood my mandate, I made it a mission to answer as many questions as possible, bothering young people. I have mentored, inspired, and helped young people unearth their potentials through the Martha Inspires Foundation. However, I feel it is time to bring the conversation much closer to you. We have you in mind, you the young person. With my team of experts, we bring to you the Reflection Show, a show that focuses on addressing issues young people face, helping them to unearth their potentials, and giving them nothing but the best avenues in helping them solve issues that they may face in their young age. Join me, Martha Inspires, every Thursday and Saturday at 8:30 p.m. on Truth TV, the Reflection Show, restoring hopes. The Reflection Show with me, Martha Inspires. We are looking at cervical cancer, and then I believe that from the conversation, it has encouraged a lot of us, if not all of us, to go and screen. You know, sometimes because of the misconceptions, and I believe that we have delved into that, many of us are scared to go and screen. And most people think that when you go and screen, you are seen as promiscuous. So, hey, I don't want them to know that, you know, I want to go and screen for this. And sometimes it's because probably we know people at the hospitals. You know,
Yes.
maybe your friend is there, your mother's friend is there. So you want to go and screen, but you are afraid. So what can, you know, medical practitioners assure us that when we come and screen, we are safe with you?
No, it's very confident.
Confidentiality.
Is there because we are centers. Centers is like a place that the place is equipped with the staff, only the staff that is going to do the screening, and also the equipment that we need for the screening. This is one. Secondly is that not all the people is going there. It's only the patient that is going for the screening. So then we also, before take the or do the screening, this part of the awareness start from even there. Because sometimes the patient is going for the screening, but they don't have too much information about the screening. So it's the moment for us to do some awareness, to get consent, to explain what is going to happen with the hair, what we are going to do, and discuss their results. And this result and this part of this time is only with the patient. It's the patient and the staff that is going to attend her and also to take the screening. So nobody can go there and also to find out what is going on, what is going on, and to talk. No, whatever is happening is remain there, and we have our book or the system to collect the information and keep the information very safely. So there is no problem at all. Not only in Tamale Teaching Hospital centers for cervical cancer,
all centers in Ghana.
All centers, because it's part of the training that our staff receiving. So the confidentiality and also how they can keep and store the information for the patient is also important. Very, very important. So I want to tell you that that is also important, that when I started the screening years back, so we screened few cases, patients. Most of the time they are patients from the consultation, those came for consultation room, and we refer and we take the opportunity to do the screening. But now, due to this awareness campaign, even the program that is going beyond a center, because it's going far, that now we are doing the screening. So that is the intention that we have with this program, with your program, that you offer your program to us, to reach our women, to reflect, to think as a reflection about cervical cancer, how they can themselves can also be part of this reduction of cervical cancer. I'm telling you, if we continue like that, so we think that in this year 2025, we reach as many as possible patients, or not patients, or women, because they are not patients, they are women. Normal women should be screened. And also it's going to reflect in our statistics. So the number of cases with cervical cancer will reduce, and the number of cases that also die due to cervical cancer also reduce in our population. This is our aims. And I'm thinking that we are, little by little, we are getting our goals.
Okay, let me come to Madam Mina on this. Let's look at treatment options. When you screen and then you are positive, what is the next thing?
When you screen and you are positive, she earlier on mentioned that thermal ablation.
Okay.
So it depends on the degree of the positive. If it is well demarcated on the surface, that is what we call the pre-cancer lesions. It is pre-cancer and not cancer yet.
Okay.
That is when we use that method of treatment. The thermal ablation is a machine that we put on these pre-cancer lesions that will later on in future become cancerous. So we use that machine to destroy these pre-cancer lesions to prevent them from progressing into cancer in future.
Okay.
Apart from that, there are other treatment options. There's one we call lip. That's the full. That one is done with
It's a loop.
It's a loop.
Electrical incision.
Electrical incision of the
incisional treatment or
cervix.
procedure.
The part that is infected, you are taken to theater and then it is incised. That part is taken away to prevent it from progressing to other parts of the body. And then when other tests are done, and then before all this is done, we do some another test called biopsy.
Okay.
So it's these results that will come out to tell you the extent of the infection. So it will tell you what you should actually do, whether we should take the whole uterus or the womb off, out, so that it will prevent it from progressing. Because if the whole womb is affected, it can even progress into other organs of the body. So this is the treatment options we actually have. And if it has already gone beyond that to other parts, we also have something called chemotherapy.
Okay.
And then we have radiotherapy.
Okay.
So this is other
What are they? You just touch a bit on that.
Yeah, so the chemotherapy, they are also drugs. It's actually, it works depending on the extent of the infection. Others get treated, but others, it is palliative, meaning we
You have
will
to manage it till
the day God will call you.
wow.
Yes, so currently at the Tamal Teaching Hospital, we do the chemotherapy, but we don't have the radiotherapy. If you need radiotherapy, that one you will need to travel to Kumasi, Konfonachi, or Kolebu. Am I right?
Yes, yes.
For that treatment, we don't actually have it
In Tamale.
in Tamale.
Okay. Doctor, you want?
But yes, the most important key of this part, the treatment you mentioned, you asked about the treatment, is that our women need to know from the screening, cervical cancer screening, if we are doing it, and the patient is there is not cancer, because we are not screening cancer, we are screening for pre-cancer. Pre-cancer, cancer is advanced.
Yeah.
That's why Amina mentioned chemotherapy, radiotherapy, even referral to other facilities. But what we are screening is for pre-cancer lesion. That this is the pre-cancer lesion that we're able to treat. We're able to treat with ablation or with a surgical procedure, minor surgical procedure. You understand? So this is the importance of that. So if we're screening, the women cannot able to refer for advanced treatment like a chemotherapy, radiotherapy, etc. So it's just a local treatment, and also after treat the patient, the wound will be there. We cannot remove the wound because it's no cancer. It's just pre-lesion or pre-malignant cancer, and the patient can keep the wound, and the patient can able to conceive in the future. So we cannot remove the wound when the patient has pre-cancer or pre-lesions or pre-malignant lesions in the cervix. And easy to treat, is affordable also, because for the treatment, in case of a surgical excision procedure in the theater, is covered by insurance.
Okay.
That one is covered
By our national insurance.
National health insurance is covered that procedure.
Okay.
For the ablation that is just local, this one is not covered, isn't it?
It's not covered.
It's not covered, but it's not expensive. And also we solve the problem with the patient. I think that is a good option for them. And from the treatment, the patient can go back home, and then we give them a follow-up, appropriate follow-up. That is also important.
Okay. Okay. Now, at the Tamale Teaching Hospital, it's, let me say, the biggest hospital in the region. Most of the referral cases are there. Now, I want us to look at, you've mentioned some of the people you've already trained in all those places. So it means that they're supposed to do education and advocacy. So that it even reduces the number of cases that come to TTH.
Yes.
Okay. So now, in the other places, I believe they give reports and then all of that based on the education that they are doing. Do you feel that many of us still are unable to comprehend? You know, I don't know how to put it. Like, is there still some bit of fear in the screening? And how can you help us to overcome the fear. Because we have mentioned that it is not painful. We have mentioned that most times the screening is either free or not
Affordable.
expensive or affordable. But
Affordable.
sometimes people still have some kind of fear.
Yes.
We've mentioned the stigma and all that, but I'm just thinking aloud. Is there something, peculiar you can, remind us or tell us about on how we can avoid all those fears and still come for the screening?
So it's part of the awareness.
Okay.
It's part of the awareness. So even sometimes, so the people that we trained, so they know that they have to get more involvement of the patient in our screening program. So this awareness must be extended to the couple, the partners, the community, So, and she's also a witness of that. So, to do awareness in our community, we need to involve the leaders of the communities.
Yeah.
And those leaders of the communities, when they are able to understand what is going on, so they're able to explain, and also they're able to sensitize their population around the community to also join. And this, in that way, the leaders of the community is, the role of the leader of the community is very crucial.
Yeah.
It's very crucial because, for instance, we cannot go to the community and say, let's go and do a screening. No. We cannot, this is not working like that.
You have to go through
We
the
have
due
to
process.
go through the process, the leaders of the community, involve them, all that we, even maybe one person is a leader, and this one has a power in the community, and they are the one convince the women to come for the screening, and this one sometimes is enough. And they are displaying their language, their language barrier, that maybe they cannot understand our language, and they say, no, this one I don't understand, I don't know why. Okay, that's why we are using the leaders of the community, and they explain to them. If I have the experience in Sablugu, I went there, and the women, when they went to the hospital, the RCH, to do is, there is a center there. So the women, the first time, we didn't see any women. The women were wasn't even they were about, but they didn't come. So what we did was, we involved one of the women, just a woman that was proactive at the place, and she was the one communicating with the rest of the women. And with the second time when we went there, so many women came, and we were able to do awareness, and then they ask questions. It's not only that you have to tell them, let's do this, let's do that. No, they are able to understand in their language. So we have an interpreter, we have a translator that also communicates with them, and they also ask questions. Whatever question they want to ask us, so we're able to answer. And in that way, so this miscommunication or misunderstanding or misconceptions is coming down, and we're able to do the screening. It's very, we felt happy when we were able to do something like that, and we get this feedback from the patient, from the population, from the staff, so it's very excited.
Okay.
It's
Yes,
excited.
I also think that when we involve the men, our husbands,
And our fathers.
it will help a lot, because they are the decision makers. They will have to tell the woman that, or give them the transportation to wherever they need to do this screening. And so if we involve them, if we let them understand what cervical cancer really means, because if the woman is down today, who is there to help you, the man? So if we involve them and we let them understand that if the woman gets infected, the woman can even die. I think they will support. The men will support, and then they will give them the go-ahead to really do the screening.
And I think apart from that, to also encourage the men to stay with just less sexual partners. It can be difficult because we are in a region where polygamy is a normal thing. where the man is allowed to marry as many wives as he can. So maybe, you know, when the men are involved and they understand these things, they will know how to, and also other women will also know how to take care of
Yeah.
themselves. So that maybe when you are not infected or you don't have, you know, the man will not even take it to carry it to the next woman and to the next woman and then all that. Yeah. So
It's a process, but we are working in small, small. The men involvement is important for all decisions. Even if we are talking now, we are talking about cervical cancer screening, but also breast cancer
it's also yes,
screening there.
yes.
But even if the patient is pregnant, the main involvement is also part
Very important.
because they are the one take the decision. That the one have to pay the bills. The woman have to consult with them, everything. That's why awareness and education is one of the key in our program.
You mentioned 25 years and above. I'm just curious. Have you had issues or situations where we have people who are 25 and less,
Yes.
you know, having that? Have you seen that before?
Yes, we have instance where some of the girls, less than, I think the youngest age we had was 17 years. Yes, 17 years. Who came with genital warts, and then the screening was done. She was also positive of cervical
Wow.
cancer. Yes. So I think we lost one. I think it was advanced cancer. We lost
And
her.
they
That
didn't
was
know. Is it
it.
that it's not painful? Like,
It doesn't actually have primary signs and symptoms. It has no early signs
ah,
and
so you
symptoms.
can have it and you will never
You will
know
not know
until.
until you screen.
Oh, okay.
It doesn't have early signs and symptoms. It's asymptomatic. It has no signs and symptoms. It only comes with late signs, which may be late, as I mentioned,
Very late.
very late for you. Yes, so that is why the screening is very, very important. So
Wow.
early detection
Saves
saves
lives.
lives.
For
Yeah.
the natural of the disease, we can see younger people or younger women
Yeah.
with the disease, but the cancer is properly a little ahead of the teenagers ages. I'm talking about the age.
Yeah.
So, but in that age that she mentioned, we can see, but not it's not predominant.
Okay.
But for these ages, what we can see is the premalignant lesions, the one we are talking of.
Okay.
These premalignant lesions, we able to diagnose on this period of age,
Okay.
and it's the time that we have to treat, do the screen, and also is positive, do the correct treatment. Because in this age, with the patient with premalignant lesion, we cannot do the screening, and we cannot treat her. So this is the one is moved to cancer in years
Yeah.
after.
Yeah.
So, and you see the patient with 25, 26, 30 years with cancer
Wow.
because it started
Way, you know, when she was way younger.
exactly.
And then,
And
wow.
also that's why the sexual intercourse is also has a key in this
Yeah.
disease.
Yeah.
Because if the woman started
Early
earlier,
exposure.
as earlier she started with the sexual intercourse, also she able to get
Yeah.
the cancer as earlier age.
Okay.
It's encouraging.
Yeah. Give me your final words. What's the call to action on cervical cancer? Let me start with you and I'll conclude, doctor.
I would like to encourage all women to prioritize their health. They should encourage others to come for screening. Our men should come out to support us because without us, you can't manage the home alone. You can't manage the children alone. So we ask for their support. They should please support us, especially in the northern region where we have this polygamy. We should encourage all the women we are married to, 2, 3 women, 4 women, please. It shouldn't be only one woman coming to screen. If you also know that you are marrying your husband with other women, please, and you come for the screening, encourage your colleagues to come and screen. Early detection saves life.
Early detection saves life. Doctor, your final words.
My final words. So even though Amina is mentioned that is very motivational in words, I think that we cannot do by ourselves. We cannot do alone. So we need to encourage our stakeholders. We need to encourage the Ghana Health Service to also support us, because so there are places that is unreachable. So there are places that are far from us. And over there, we have women that coming to the hospital in late stage of cervical cancer. And we need to go there. And that's why we need the support from our stakeholders.
Yeah.
Ghana Health Service, hospital, CEO, district hospital.
Everybody needs to come in.
Has to come aboard, because this is a situation that we must reduce in the early future. We need to reduce this incidence of cervical cancer, or the problem of cervical cancer in our population, because we need to keep saving our women life. This is our end. This is our main goals.
We need to save the life of the woman, because everything, the man, the woman, and all that, we are, you know, men can't really do without us. So come on board as men to support women so that we can stay safe. And to every young woman out there, your health is more important. So do anything as much as possible to prevent yourself from any kind of diseases, especially for this content, cervical cancer, because the man you are probably sleeping with will move on to the next girl when he finds out that you have cervical cancer, and it's just left with you to treat yourself, and that might be so expensive that he may not even want to even take care of you. On that note, do well to go and get screened for cervical cancer. If you are in Tamale, you know where to go. They've mentioned SDA, West Hospital, Tamale Teaching Hospital, Central, all the hospitals in Tamale, even private facilities. The most important thing is that go and get screened. Thank you so much for watching. I have been speaking with Dr. Anna Maria Simonu Sharadan. She's a consultant in obstetrics and gynecologist at the Tamale Teaching Hospital and the principal investigator of the cervical cancer screening program in the northern region. And Miss Amina Atepaga, she's a midwife in charge for the cervical cancer prevention program in the northern region as well. And I believe that this conversation would encourage you, even if you're a man watching this, allow your wife, your sister, your mom, any woman in your life to go and get screened, because we all need to stay safe. Thank you so much for watching. I'm Martha Inspired. Do have a good night.